Good morning, friends. This is your expert, Dr. Nitin Tiwari from Infigo. So, today I'll be talking about the Lasik procedure, as there has been a lot of misconceptions and myths revolving around. So, in this session, I will try to make the discussion about Lasik questionnaire based and try to solve all your problems. So, this will be more of a questionnaire based session. So, going about it, the one of the most commonly questions being asked by the patients is what is Lasik? What does it do? So it's nothing but a small, I would say, a rather procedure instead of being a surgery, which is used to remove your glasses power or the contact lenses which you have been using it for a long time. So this has been brought about by certain modification and changes on the black part of eye. It is also called as cornea. I will try to keep it in as possible as a layman's term so that it's easier for you to comprehend and process accordingly. Second question is what is the age limit? Who all can undergo LASIK at what age? Legally speaking, the age is 18 years of age. Above 18 years of age, we usually recommend for the patient to undergo LASIK. But the usual I personally prefer to do after the age of 20. The whole logic behind that is that after at the age around 20, your physical growth stops, and that's why most of the times your refraction becomes stable, and that's very essential for the LASIK procedure to be successful, that your refraction remains stable over a period of at least 6 months to 1 year time. So anything between 20 to 40 years of age is a very reasonable age criteria to undergo LASIK procedure. So it's very important to take into consideration various aspects. So another is who all can undergo LASIK procedure. I am talking in terms of the power. So people usually who have minus power, in medical terms we label it as myopia, and in terms of the plus power is called hyperopia. So anything in the range of -1 to -8 or 9 diopters of power, we have successful results of LASIK being already done. And in the range of plus power, somewhere around +1 to +3, the results are pretty satisfactory. Anything beyond -9 power or 10 power, or something above +3 power of hyperopia, which is extremes of power, it is preferable to go for an implantable contact lens, which is called ICL surgery, another procedure which I will be taking it later on, because the results of LASIK are not very much convincing in these cases scenarios. Then coming up, a very frequently question asked by patients is, I am wearing contact lens. Am I suitable for undergoing LASIK procedure? Yes, definitely you are. Like people I have seen, in fact, I would suggest the patients who are wearing contact lenses are one of the best candidates for undergoing a refractive or LASIK procedure. One of the few special, I would say, precautionary measures which they need to take is that they have to, if they are using especially soft contact lenses, they have to remove 1 week prior to undergoing the topography or the LASIK procedure. And in case of hard contact lenses, they have to remove the contact lenses at least for 2 weeks before undergoing the LASIK procedure. So what is the basic, if suppose you visit the hospital, what do you need to do? This is another question which people and patients usually ask. So one is the daycare routine. You have a ophthalmic evaluation of your anterior segment and the back side of the eye, which is also called retina. Once everything is all right, you just need to undergo the corneal topography. In layman's term, corneal topography is nothing but it is the mapping of your cornea on which we are going to do the LASIK procedure, and it helps to know whether what is the shape and size of your cornea. If these two criteria are met and if everything is all right, definitely we can go ahead and do the LASIK procedure. Then people ask, after all these basic things are done, what are the types of LASIK and what is suitable for each individual person? There are basic three types which I have categorized for your simplicity. One is the flap-based procedure. Now, flap-based procedure is another two types. One is a blade using flap, or second is the bladeless LASIK, which is also called as most commonly as femto-LASIK procedure. Second is the flapless with bladeless technology, which is also called as SMILE, which is the most latest advancement in the era of refractive surgery. And thirdly, it's also called as surface LASIK, also called as PRK. Now, of all the three, they have various advantages and disadvantages, and it's individual choice what we have to decide upon. But For that, we have to sit one to one and decide upon various criteria looking at the corneal topography. Most of the eyes which are suitable, if your everything is all right, you can go ahead and do any of the procedure. You do watch my video. One of the details for each individual procedure in one of the next sessions as a part of educative session. This particular among the three, I personally prefer to do criteria wise. I would rate Smile as the best, technology driven, with the least minimum amount of discomfort and complications, followed by femto Lasik, and last the blade Lasik. So, what is the general procedure once you visit the hospital? You have made up your mind to undergo a Lasik surgery. What all things need to do? Once your all the criteria and basic evaluation has been done, you will be asked to visit the hospital. The procedure itself takes around 5 minutes each eye. I am not talking about the logistical part. On table, you just need to be 5 minutes for each eye. So 10 minutes when you've done the surgery and you can move forward. And post-operatively, there are certain medications which we'll give for a month's time. And there are certain speculations regarding what special care which should people take about, especially youngsters who are willing to undergo LASIK. So I personally recommend them if someone is undergoing or is involved in contact sports, if somebody is in athletic, swimming, gymming, these little more, I would say, aggressive sports should be avoided at least in the first 10 days. And after that, things are all right. You can definitely go ahead and do all these things. One of the other questions is, can I undergo LASIK at the age of 40 years? Like I mentioned earlier, 20 to 40 years of age is the golden period you have in the best results of LASIK. Yes, definitely you can undergo LASIK at 40 years of age, but there is a special LASIK for at this particular age group, which is called as monovision LASIK. Here we try to make it one eye dominant and the other eye we correct, try for the near, other eye for the distance. I will not go into the technical details, but yes, definitely you can go ahead and get it done at 40 years of age also. Apart from that, we at this particular age, we have to also take into account the lenticular changes which usually happens in the lens also. Then the question arises, I think this is very commonly being it bothers the patient is, does insurance cover the LASIK surgery? Frankly speaking, as of now in India, LASIK surgery or any sort of refractive surgery is a cosmetic surgery, so it is not usually covered by insurance. But I think many of the companies are giving some concessions in terms of higher powers of refraction to some of the patients, which is an individual based. So, but frankly speaking, as far as the cosmetic surgery is concerned, the insurance usually don't cover such surgeries inside. Last but not least, what are the main disadvantages people are very scared of? They have a lot of myths about dry eyes, because in today's era, people are highly educative about things which they are undergoing. Yes, dry eye is a known, I would say, complication which occurs after most of the refractive surgeries. And if I have to rate which is the best among the two, I would rate the Smile being the most best giving advantages as far as the incidence of dry eye is concerned, which is the least among all the refractive procedure. So I would rate the Smile as the first, being the best. Then I would rate femto Lasik, which is the bladeless Lasik, as the second, which I would rate as better. And third I will rate as blade LASIK microkeratin based as the good choice. So basically among the three, good, better, best. So you have to decide which you want to go ahead depending upon your budget, depending upon the advantages and disadvantages. Do consult your doctor. I am the refractive surgery in Infigo Eye Care, and I'm sure in detail we will be able to remove all your doubts. And once the procedure and doubts and everything has been cleared, you can definitely go ahead and undergo the refractive procedure. Thank you.